2. Transverse colon. Passes through the abdomen in a downward arch. Starts. Right hypochondriac, HC, region, L2. Ends. Left hypochondriac, HC, region, L1, forming the left colic, splenic, flexure. Peritoneal relation. Intraperitoneal. Mesentery. Attached to the posterior abdominal wall by the transverse mesocolon. Anterior relations. Greater curvature of the stomach. Upper part of the duodenum, by the gastrocolic ligament. Superior relations. Liver, right side. Stomach and spleen, left side. Posterior relations. Duodenum. Pancreas. Inferior relations. Small intestine. 3. Descending colon. Extends from the left colic, splenic, flexure to the sigmoid colon, at the level of the iliac crest. Region. Left lumbar region. Peritoneal relation. Mesoperitoneal, covered by peritoneum on the front and sides. Anterior relations. Anterior abdominal wall. Lateral relations. Lateral abdominal wall. Medial relations. Small intestine. Posterior relations. Left kidney. Quadratus lumborum muscle. 4. Sigmoid colon. Extent. Left iliac crest, right pointing arrow sacral promontory, where it continues into the rectum. Peritoneal relation. Intraperitoneal. Mesentery. Present, hence, mobile. Region. Hypogastric region. 5. Rectum. Parts. Ampulla recti. Located in the lesser pelvis. Posterior relations. Sacrum and coccyx. Anterior relations. Males. Prostate, urinary bladder, seminal vesicles, and ampullae of the vas deferens. Females. Uterus and vagina. Canalis analis. Ends at the anus. Rectal curvatures. 1. Flexura sacralis. Protrudes backward. Corresponds to the concavity of the sacrum. 2. Flexura perinalis. Protrudes forward. Located within the perineum. Rectal peritoneal relations. Upper, intraperitoneal. Middle, mesoperitoneal. Lower, retroperitoneal. Sphincters of the rectum and colon. Internal anal sphincter, involuntary. Thickening of the muscular layer at the anal canal. External anal sphincter, voluntary. Beneath the skin of the perineal region. Wall layers of the rectum. 1. Mucosa. Forms semilunar folds. The ampulla of the rectum has 8-10 longitudinal folds, anal columns. Anal sinuses are located between these folds. 2. Lamina propria. Contains intestinal glands, for secretion and absorption. 3. Tala submucosa. Contains small lymphoid nodules. 4. Muscularis. Circular layer, internal. Longitudinal layer, external. Thickened muscular portions called colic sphincters. 5. Gussus sphincter. Located at the right colic flexure. Sphincters in the transverse colon. Beginning, right Kennan sphincter. Middle, left Kennan sphincter. Left colic flexure, Peyer's sphincter. Sigmoid rectal sphincter. Located between the sigmoid colon and rectum. Sigmoid colon sphincters, superior and inferior sigmoid sphincters, located within the sigmoid colon. Ligaments. 1. Superior iliocecal ligament, connects the ascending colon to the peritoneum. A continuation of the mesentery. Attaches to the lower medial surface of the ascending colon. 2. Mesenteric inguinal ligament. Begins, mesentery of the terminal ilium. Ends, right edge of the midline into the lesser pelvis. In females, continues as the suspensory ligament of the ovary. In males, passes into the deep ring of the inguinal canal and continues into the parietal peritoneum. 3. Left diaphragmatic colic ligament, connects the left colic flexure to the diaphragm.